Welcome back to the Rebel Core Content Podcast. Core content for anyone, anywhere, and just in time. This is Swami, and today we've got something a little bit different. We started a new project at Rebel EM called our Clinical Conundrums. These are questions that often come up while we're working clinically, and we dove into the literature to try and give hard recommendations on how we can address these questions when they come up. We're going to get into one of those clinical conundrums today. Does IM ketorolac provide superior pain relief to oral ibuprofen? Let's start with a common clinical scenario. A 34-year-old woman presents to the ED with back pain. After you take a history and physical, you conclude that the patient's pain is muscular in origin and likely secondary to heavy lifting while moving apartments. You contemplate analgesic options and decide that an NSAID makes sense. Should you give her oral ibuprofen or intramuscular ketorolac? Often our gut tells us to give the ketorolac IM. IM ketorolac is going to provide better pain relief, and the patient will be happier with her care since she got an injection. And after all, she came to the hospital. Why are you just going to give her oral meds? The evidence, though, plays against what our gut says. Unlike with many areas in medicine, there's actually ample evidence to answer this question, and most of the evidence has been around for a couple of decades. There are a number of different studies on this topic, as well as a really well-done 2007 review of the literature that concluded there was no difference in analgesic effect between intramuscular ketorolac and oral ibuprofen. That study had, again, a number of high-quality research studies. We will have a table in the show notes outlining those high-quality studies. The data seems to be pretty clear here about analgesic efficacy, but it doesn't really address the issue of, do some patients simply prefer to receive a shot? This is, again, a dogmatic claim that you hear all the time. The patient came to the emergency department, they would prefer a shot over an oral agent. Let's go ahead and give the shot. It's almost as if there was a placebo effect attached to simply getting a shot, in spite of the fact that there is equal efficacy and analgesic effect. Fortunately, we have a nice study looking at that question by Schwartz in 2000, and this is really a brilliantly designed study. They enrolled 64 ED patients with acute pain, and they had two treatment arms. The oral group got an orange drink with 800 milligrams of ibuprofen plus a placebo ibuprofen pill. The other group got the same orange drink with 800 milligrams of ibuprofen plus a placebo injection of ketorolac. Essentially, all the patients in this study got the same analgesic medication, that drink with the ibuprofen in it. But some of them thought they got a shot, and some of them thought they got a pill. What Schwartz found was no significant difference in analgesia between the two groups. I think these findings surprised people because, again, I think we believe that patients want that shot, but the data doesn't really show that to be true. The bottom line on this question of intramuscular versus oral NSAID is we should just give the NSAID by mouth. Intramuscular NSAIDs may provide a slightly faster time to analgesia, but an IM dose comes with the cost of injection and pain and a longer time to prepare the dose and more intensive nursing resources than to administer an oral dose. As long as the patient's gut works, oral NSAIDs provide similar analgesic effects to IM dosing and should be the preferred route of administration. Before we wrap up, there's a couple of bonus pearls to take away with this topic. Intramuscular injection of ketorolac actually can be significantly painful. If the patient can't take an oral NSAID, be kind and pop in an IV to give that ketorolac IV instead of IM. And then secondly, the ceiling pain relief dose for ketorolac is 15 milligrams IV. We'll have a link to a fantastic study by Sergei Motov looking at exactly that question. That's all for the Rebel Core Content Podcast this week. We'll be back in 2 weeks for another cast. In the meantime, don't forget to pop on over to the site, check out the show notes for this particular topic, as well as all the other great content that we've got on the site. And until next time, stay safe.